Hello, my name is Cheryl Harris. I'm the Clinical Informatics Nurse Manager, and today we will do a tutorial on how to complete the patient warning letters within TouchWorks. We have now removed the no-show warning letter and the behavior warning letter from your current patient communication note within TouchWorks. We have now separated them out to two individual notes. The behavior warning letter does require a finalized signature for the provider, and the no-show warning letter does not require the provider's signature. We'll go through the process of completing both today. We'll start with our no-show warning letter. You would do this just as you would starting a new V11 note. Come here to your specialty, and then in your drop-down, you will have the option for your no-show warning letter. For me today, it is a little further down. So you'll just select SIU no-show warning letter. Make sure your provider is the owner of the note and hit OK. Selecting OK brings you into your note authoring workspace where you will see your patient communication letter greeting, which is standard. You'll then go to the SIU no-show warning letter form. If you notice, this now has been broken up into each warning, the first warning, your second warning, and third and final warning. Each one of these selections has a little bit of a different verbiage that is appropriate to which warning you're selecting. So for today's tutorial, we're going to select second warning. We will type in our department here. And then the date of the no-show appointment. We'll then go to our SIU closing for the no-show warning letter. If you notice here, you've got your pre-filled text for who to contact. We'll select sincerely and enter the provider. Okay. You have now completed your no-show warning letter. You have a couple options now to make sure you're able to get this printed appropriately. The no-show warning letter, as I stated, can be finalized by the clinical staff. So either an MA, nurse, or your front desk staff can finalize this document. So you can sign. My only suggestion would be, though, is not to sign it before you print it. Reason being, when you print it, if you sign before you print, it is going to print out with your electronic signature, which includes your full name. So at whatever comfort level you have, you can do this within the sequence that fits your needs. So first, what I would like to do for efficiency is go ahead and save this document. And then we're going to come over to our view. And this is where we'll be able to print this note. So if you notice, just with those small things that you selected previously, this whole note is now generated based off those options. You'll now come down to print. If you already have a default printer selected, that information will show here. If you do not, go ahead and do your drop down here and select what printer you need and save as default if that's a printer that you print from often. Also here, make sure that you have patient letter selected. Selecting patient letter, make sure that the document is printed in a way that you're able to fold it and have the patient's information visible in your windowed envelopes, as well as it makes sure that the appropriate letterhead is printed out on your document. So if you are working for one particular department or division and that is always who you print notes for, go ahead and make sure that you save whatever patient letter that is appropriate as your default. So you would just save that, click Save as Default. Once all that information is entered, you'll then have the option to select OK. But for today's tutorial, we are going to preview. Preview shows you the document that's going to print. This will print in black and white, as all of our printers typically print black and white. If you notice, you have your letterhead here appropriately because we picked the correct patient letter. And then you have the space here that's going to include your patient information, including address. We use a test patient today, so we're not going to see a patient address here. But if you notice, clicking patient letter allows this portion to print the way it appears so that you're able to just fold it and put it into a windowed envelope appropriately. Okay, so this is what this is going to look like when you print out. You would then just print it and mail to your patient. After mailing to your patient or after printing, you would just go ahead and close out these boxes here if it doesn't already take you back to your note authoring workspace. And as the nurse or MA, you would then sign this document. It's going to bring a window here. Do you want to make final? Yes. And you select OK. You've now completed your no-show warning letter and printed and sent to the patient. Now, to be able to do your behavioral warning letter, you will start just as you started previously to create a V11 note. You would then find your behavioral warning letter here in your drop-down and select. Again, if you should have a default owner, if not, make sure that your provider is listed here. Now we'll stop to note that this SIU behavior warning letter must be finalized by a provider. You can mail it to a patient before it is finalized, but it has to be signed by a provider. So you will not sign this document. Okay, so we'll go in and start this V11 note for behavior warning letter. Again, it'll bring you into your note authoring workspace. You'll see your standard patient letter greeting. You'll select your patient. And then you'll go to your SIU behavior warning letter form, which is new, and you'll input the date that the patient exhibited the behavior. You'll select the behavior that was displayed. This dropdown lists the behaviors that by standard and risk and safety have been approved to send a behavior warning letter when it's related to these types of behaviors. So for today, we're going to select cursing, and then we're going to type in our department. Okay, then we'll go to our letter closing, and we'll put our department one more time. Unfortunately, we're not able to link those two forms, so you'll just type in surgery here, or whatever your department may be. We'll follow the same process of saving, and then you would go to your view. Notice the information that is filled in here based off those small selections that you picked previously. And then you're going to go to your print option. Same information applies. If no default, please set your default. If you're at that same printer on a regular basis, ensure your patient letter head information is correct. If not, again, you can save as default. OK would be available once those things have been completed. Today's process, we're going to click preview. Again, making sure you pick the right letterhead allows you to print with the foldability to show through your windowed envelopes. The information is listed here. And if you notice, this is the approved standardized block, signature block for these behavior warning letters. So we want to ensure that you complete all of those, okay? And this is what is going to print for your patient. You'll then print, mail to your patient. You can close out of here. You hit cancel. You've already saved, so we'll just come back here and hit save and close. Okay, and then that sends a task to your provider to finalize the document. You've mailed out that patient letter. All of your responsibilities have been fulfilled. Just for review, we will remember that the no-show warning letter can be finalized and signed by clinical staff, MA, front desk staff, or nurse. The behavior warning letter must be finalized by a provider, so only save and close that note. Please do not sign that note. If you sign it, it will actually send a co-signed note task to your provider. But either way, best case scenario is just save and close as you do your typical patient notes to go to that provider to review and sign. Okay, if you have any questions on the functionality of how to create these documents within TouchWorks, please reach out to your clinical informatics nurse. And if you have any questions about when to send a no-show warning letter, when to send a behavior warning letter, reach out to your department admin or risk and safety. They can answer those questions for you. Thank you for joining today's tutorial.